There are several different injection techniques for the Restylane Vital products. The best technique and product to use will depend on a variety of factors, such as indication to be treated, patient needs, and personal preferences on the practitioner's part. For safe use of Restylane Vital and Restylane Vital Light, it is important that the needle is properly attached to the injector or the syringe. For instructions on how to use the Restylane injector, please see the chapter, The Restylane Injector. To attach the needle to the syringe, hold the narrow part of the needle shield loosely and turn the needle shield clockwise until you feel counterpressure. Then grasp the wider part of the needle shield firmly. Press and turn the needle shield 90 degrees, a quarter turn. The quarter turn is necessary to lock the needle onto the syringe. Insert the needle to the desired depth in the dermis. Restylane Vital is injected in mid to deep dermis, preferably deeper, and Restylane Vital Light in mid dermis. Avoid injecting Restylane Vital products superficially, as this may cause lumps or bumps. There are a few basic techniques to use when injecting Restylane Vital products using the injector or the syringe. The micropuncture technique involves the injection of microdeposits over the selected skin area. The injector is well suited to this task, as 10 microliters of product is deposited each time the dose activator is pressed. Promptly move from one site to the next and immediately insert the needle to minimize any product waste. When performing the micropuncture technique with a syringe, care must be taken to gently push the plunger to deposit small amounts of product over the treatment area. When using the short linear technique with the injector, you insert as much of the needle length as desired into the skin. While retracting the needle in a retrograde direction, deliver 2 to 3 microdeposits by clicking the dose activator. Make sure the injection is completed before pulling out the needle. If needed, the needle can be bent 45 degrees for more convenient injection. With the syringe, the linear techniques can be used. Insert the full length of needle into the skin, and while slowly withdrawing the needle, deliver a long thread of product. You can also gently press the plunger for 3 separate deposits. Areas such as the neck, décolletage, and the back of hands, we recommend you use Restylane Vital Light due to thinner and more delicate skin. To avoid overdosing in these areas, it is recommended that you use the Restylane injector to ensure reproducibility of the very small volume injected each time. Treating hands, both the micropuncture and the short linear technique with Restylane Vital Light can be used. Treating necklines, the linear techniques can be used. You insert as much of the needle length as desired into the skin. While retracting the needle in a retrograde direction, deliver a long thread of product or inject 2 to 3 microdeposits and draw back for each deposit. Full rejuvenation in the neck is obtained by using either the linear techniques or the micropuncture technique. When treating the décolletage, both the short linear and the micropuncture techniques can be used. The inframammary fold, the short linear technique, is to be preferred. Restylane Vital products can also be used to treat superficial acne scars. For this indication, the short linear technique is to be preferred. Make sure that there is no active acne at the treatment area. Place the needle just under the acne scar in order to soften up the fibrosis under it, and then inject the product. Restylane Vital will moisturize the skin and help to soften up the acne scar, and over time, give a slight lift to the depressed tissue. Remember to change the needle frequently when treating acne scars.